Good morning and welcome to CSG University's Spotlight On. Today our featured presenter is Nina Geyer of Bancroft Rehabilitation, and she was speaking about traumatic brain injuries and the outcomes used for measurement. So thank you for coming in, Nina. It was a very informative presentation. Lately, traumatic brain injury has received a lot of media attention, particularly surrounding the cumulative effects of multiple injuries. Can you give us a brief overview of how TBI is diagnosed?
Right. Traumatic brain injury is diagnosed, first of all, by the etiology of the injury. So there needs to be a documented trauma where there's an external force that's applied to the brain. So that happens, through motor vehicle accidents, falls, industrial injuries, contact through sports, and things of that sort.
What is the average age of the patient population that you treat?
The average age at Bancroft tends to be in the 20s and 30s where the incident occurs. Because some of our population is with us for several years, we do have people from their 30s to 50s residing in our residential programs and receiving services through our day treatment or outpatient services. The high-risk groups for traumatic brain injury are actually males are twice as much at risk as females for receiving or experiencing a traumatic brain injury. And then the high-risk age groups are from the mid-teens through the mid-20s. And then in older populations, greater than 60 years old, more likely to have traumatic brain injuries due to falls.
What's the average length of time that somebody is treating with one of your facilities?
Mm-hmm. It's variable based on individual needs. There are some people who need a shorter course of treatment to deal with some of the more acute effects of their traumatic brain injury. But traumatic brain injuries, especially severe traumatic brain injuries, have really long-lasting effects and deficits that are chronic in nature. And many individuals require some level of treatment over the course of their lifetime, either as in a residential setting or outpatient or day treatment services.
What are some of the types of services and programs that are offered in Bancroft? And you just mentioned there are various settings that they're offered in.
We have residential services that include supported and supervised apartment programs as well as group home programs. And we have those clustered around our geography of New Jersey, located in Cherry Hill, New Jersey, Plainsboro, New Jersey, and Brick, New Jersey. And at each of those locations where we have residential programs, we also have day treatment services where our individuals can be treated as outpatients and receive day programming as well as skilled therapy program that includes physical therapy, occupational therapy, speech therapy, cognitive rehabilitation therapy, neuropsychological services.
What are some of the measures that are used to assess patient outcomes?
Mm-hmm. In the post-acute rehab setting, we use a variety of outcomes measurement tools. We do participate in a collaborative project with the Pennsylvania Association of Rehabilitation Facilities, and the tools that are used in that project are the Mayo Portland Adaptability Inventory, the Supervision Rating Scale, the World Health Organization Quality of Life measure, and at Bancroft we also use satisfaction tools.
How often are they assessed?
Right, we assess our individuals every 6 months.
Okay.
And we use that outcomes data to help make decisions about clinical treatment, as well as looking at the data in aggregate so we can look at our program outcomes overall.
Great. Very good. Well, thank you for this very informative session at
You're
CSG
welcome.
University, and have a great day, everyone.